A few weeks ago, I decided it was time to upgrade my tracker, ideally before I left for a long weekend trip to the East Coast. So after at least an hour spent reading scores of comments by reviewers like you, I ordered Fitbit's Charge HR from Prime Now at 7:30 at night. And as promised, it was delivered to my doorstep within 2 hours. So what does this anecdote have to do with the 3 major change drivers for healthcare providers? Hi, I'm Amy Ground of the ABL organization, and it's all about consumerism. We're in an era when people like me, and likely your patients too, trust the candid remarks of people they don't know, but with whom they have something in common, be it an interest in the latest biometric tracker, alternative treatments for their medical conditions, or candid reviews about various providers. The fact is, we've been Amazon primed to believe that we should expect our healthcare providers to provide service that's simple to navigate, rapidly delivered, high quality, and increasingly transparently affordable. That brings us to the second major change driver: new forms of competition. No longer is the competition the small medical group down the hall or the hospital across town. Increasingly, health plans are value-based contracting with narrowing networks to the point that providers who've previously had contracts with them are being frozen out by providers who are meeting a higher bar of clinical and financial metrics demanded by the plans to keep their star ratings up. The other form of competition comes from new ways of getting care, like CVS's Minute Clinics and telemedicine providers like Amwell, Doctor on Demand, and Teladoc, which are virtually available nearly 24/7. Or like St. Louis-based SSM Health, which has 24 hospitals, over 300 physician offices, 10,000 providers, and a health insurance company serving patients in Illinois, Missouri, Oklahoma, and Wisconsin. SSM Health now offers all residents of Wisconsin and Missouri, established patients or not, health insured or not, $25 virtual visits within an hour of requesting an appointment. And if they can't address what ails you over the phone, you have to be treated in person, the virtual visit is free. The third major change driver could be consolidation, particularly with the recent $29 billion mega merger of Dignity and CHI into Common Spirit Health, which now serves patients in 21 states with their 142 hospitals and more than 700 care sites. Yet to me, the more intriguing trend is collaboration. The Wall Street Journal recently announced that Civica RX, the nonprofit generic drug manufacturer founded last year in response to drug shortages and high pricing in the U.S., expects to be distributing 2 antibiotics to the 800-plus hospitals that are now a part of the Civica consortium by September. And these are just the first 2 of 14 generic Civica expects to start producing this year. Another example of collaboration was the announcement in March that Providence St. Joseph Health and Cedars-Sinai agreed to create a joint venture to own and operate Providence Tarzana Medical Center as Providence Cedars-Sinai Tarzana Medical Center in the San Fernando Valley. And while Providence will retain controlling interest in the center and the hospital will retain its Catholic identity, it will also embrace the diversity of all faiths. It will also embrace Cedars-Sinai's money, as the site's build-out and redevelopment is budgeted at $542 million for a new patient care tower with private rooms, an expanded emergency department, new diagnostic and treatment services, and enhanced outpatient and ambulatory services. So it's easy to see that 3 of the biggest drivers of change for healthcare providers today are consumerism, competition, and collaboration. How to recognize their potential and act on them is what we discuss in ABL's monthly healthcare roundtables.